Thank you very much. I'll start with what Sarah started with about ICPD, International Conference on Population and Development, which was held in 1994. And why I would start from there is that prior to that, women's health concerns were addressed as maternal child health care and family planning at the most. That was the conference, and we must be proud of that because of the contribution of Dr. Nafis Sadiq in that, because she was executive director of UNFPA, and many would say that it was her brainchild, or she was the person who orchestrated the whole program of the conference and gave the direction that the conference took. Now, that conference brought about the change in the definition, and at that time it was said that that has brought a paradigm shift in our approach towards women's health. And UNO's definition, or World Health Organization's definition of health, changed to that it is a state of women's mental, physical, and social well-being, and not merely the absence of disease, and that all women should be provided the opportunity of reproductive health and rights consultation and the facilities. So therefore, this paradigm shift brought in the woman's whole life cycle into it. Now, if you look at it from technical point of view, women's health is very much different from men's health. Men do not menstruate. Men do not reproduce. Men do not undergo a menopause. So therefore, the objective is to look at women's health as a whole. And therefore, it has been divided into 4 areas. One is from birth to adolescence. Adolescent health has its own issues and problems. And then there is reproductive life, roughly from the age of 15 to 45, and then the age of menopause. So these are the 4 stages or in a woman's life which have their peculiar issues and problems. Men do not have that. And in addition to that, there are overarching issues of sexual health and sexual rights, which are beyond that. So ICPD made a lot of difference so far as people's approach towards women's health was concerned. I remember when that ICPD objectives were launched, even in Pakistan, through Family Planning Association and others. We talked about maternal mortality ratios, and I'll just allude to a particular aspect that Dr. Zeba Sattar said. That was the delays. Generally, it is considered to be 3 delays which are responsible for maternal deaths. One is, the first delay is at home, where the decision is being made whether to take the woman to the hospital or a health facility or not. There are so many people who are involved in that decision, the husband, the mother-in-law, etc., etc. Second delay comes in finding the transport, getting from home to the facility. And the third delay happens at the facility, which is not timely intervention or wrong intervention. Then we do not have blood bank services. Almost 40% of maternal deaths occur because of what is known as postpartum hemorrhage. And therefore, women die of excessive hemorrhage. Another important cause, of course, that has been already mentioned is unsafe abortion. Unsafe abortion, the issue is so much, as has already been said, that 45% pregnancies are unwanted. Out of these, 34% result in unintended births, and 54% of them, they end up in abortion. In the survey which was previously mentioned, it was estimated that 623,000 women, they were treated in various facilities for unsafe abortion complications. Now, to address that, what is important to avoid and prevent unsafe abortion? How can we do that? By use of contraception. And if I tell you about contraception, Family Planning Association of Pakistan came into being in 1953. The first Ministry of Population was created in 1966. In 1960s, the contraceptive prevalence rate of Pakistan was 5%. And in 1990, the contraceptive prevalence was 12%. In those more than 2 decades period, per year increase in contraceptive prevalence was less than 0.5%. And then from 90 till 2000, in those 10 years, there was a great increase. So much so that from 12% it became 33%. But then in years 2004 and 5, there was a decline and it became 30%. And the latest figures, according to UNFPA State of World Population, in 2019, the contraceptive prevalence rate was 33%, but unfortunately, in 2022, it is down to 29%. So that is those are the kind of figures that we are dealing with about contraception. And this is the cheapest and easiest way of avoiding or preventing unintended pregnancies, of reducing the rate of unsafe abortions. Unsafe abortions are responsible for about 12% maternal deaths. Right. Another thing is the gender gap. We have been talking in the previous session also, Pakistan was compared with Afghanistan. Just 2 weeks back, we had a conference of obstetricians and gynecologists of South Asia, South Asian Federation of Obstetrics and Gynecology, and I made a presentation where I put figures of South Asian countries in perspective. And unfortunately, in every area, Pakistan was next to Afghanistan. We did not come anywhere near, whether it is education, whether literacy. About literacy, if you look at it, since 2005 till 2022, there has not been any change in literacy rate. As a matter of fact, there were 5 years during these 17 years when literacy rate came down. Now, if you are looking at that literacy rate coming down, what do you expect? And it has been seen, there was a recent report from European Union. They had carried out a survey, and the only intervention that they thought could contain world's population was women's education. And then gender parity, intimate partner violence, those are the issues which do not necessarily remain only sociological issues, not only legal issues, they are also medical issues. So the community of doctors who deal with women, they also have to be sensitized about the telltale signs of violence, and they need to have that conversation with their patients. So these are various issues, and Dr. Zeba very rightly said that it is the intent or the political will. I generally give an example of this, that if you go through, just last sentence, if you pass one of these flyovers, you would see that Paya Takmeel, itna और वगैरह वगैरह इतना खर्चा और ये 100 दिन में complete हुआ. They can complete that flyover in 100 days because they wanted to do that. But here, we haven't been able to achieve any of these objectives because we do not want to. Probably these are not our priorities. Health and education are not our priorities. And so long as they are not our priorities, we will remain as we are, unfortunately. Very sad to say. Thank you.